A team from the Centers for Disease Control and Prevention is in Dallas today, investigating why a hospital sent an Ebola patient home, potentially exposing others to the deadly virus. This is the first Ebola case diagnosed in the U.S., and here is Manuel Bojorquez.
The patient, identified as Thomas Eric Duncan by CBS Dallas station KTVT, was visiting family from his home in Liberia. He is in serious condition and has been in a specialized isolation room at Texas Health Presbyterian Hospital since Sunday. There are questions about why he wasn't admitted 2 days earlier on the 26th when he first came to the hospital with a fever and abdominal pains. A nurse using a checklist asked whether he traveled from Africa. He answered yes, but was released. Dr. Mark Lester is with the hospital.
Regretfully, that information was not fully communicated throughout the full team.
So was there a breakdown? Should he have been admitted that day based on the information that he had traveled to Africa or from Africa?
I can't answer that question because that's one piece of information that would be factored into the entire clinical picture.
The miscommunication put more people at risk of exposure. Texas health officials are monitoring 12 to 18 people who may have had direct contact with the patient, who was staying with relatives at this Dallas apartment complex. That includes 5 children. They have not shown symptoms, but will not return to school until doctors clear them. Texas Governor Rick Perry sought to calm fears.
This case is serious. Rest assured that our system is working as it should.
The 3 paramedics who brought the patient to this hospital on Sunday have tested negative for Ebola. Still, they are being isolated and monitored for symptoms. Scott, the ambulance that was used has been quarantined for decontamination.
Manuel, thanks very much. Our Dr. Jon LaPook is joining us now. John, we just heard the governor of Texas say the system is working as it should, but the point of the story is it's not.
Right. While the CDC remains confident that this Ebola infection can be stopped in its tracks, the organization, the CDC, has real concerns about what went on there and why protocol was apparently fumbled. I mean, after all, for the last month or two, they've been sending out all sorts of e-blasts and communications. I've gotten them saying, be on the lookout for Ebola. And that means that symptoms is like fever or nausea or headache, minor ones that can seem like a virus. Think of Ebola and always ask a travel history. And yet here, the first time when somebody comes in who turns out to have Ebola, comes in and protocol should be followed, it's apparently fumbled.
This is the kind of story that causes people to refocus on Ebola and ask fundamental questions. You had a Facebook chat today. What was the #1 question?
Well, people were really concerned about who might be at risk, and specifically one person wrote, I have questions. My main concern is the transmission of the disease, and she specifically wondered if it's perhaps spread by coughing or somebody sneezing. And the CDC, every expert has said time and time again, it's not spread through the air. You need to have direct contact with fluids, and in addition to that, there has to be some sort of break in the skin or maybe through contact with mucous membranes in the mouth or the nose. So this is not easily spread, and people should really know that.
Dr. Jon LaPook. John, thank you very much. If you have questions about Ebola, you can send them to Dr. LaPook at facebook.com/CBS Evening News.